We're really excited to partner with SpringWorks Therapeutics to try to bring more attention to neurofibromatosis type 1 PN. That's definitely a mouthful. So NF1 is actually it's the most common tumor predisposition syndrome. It affects about 1 in 2,500 people. And one of the most common manifestations is developing these plexiform neurofibromas, or PN. And these happen in about half of patients with NF1. And these tumors tend to be very big. They can happen anywhere in the body. And they cause a lot of problems for patients. They can cause a significant amount of pain. They can be very disfiguring. And depending on where they are, they can even be compressing organs and cause organ damage.
Yeah, so I was diagnosed at a very young age, and when I was real young, I had two surgeries in 1 year. And one of the first surgery, they can only remove, both of them can only remove part of the tumor without paralyzing me. The first surgery, they removed it, it was the size of a foam football. Then the second, it was the size of a golf ball. And that entire year was a prime year when I was a kid to where I was supposed to learn, how to swim, ride a bike, all that. And I was pretty much bedridden. And throughout my entire life, I was basically either mobility or bedridden issues to where I couldn't play a lot of sports, or I had issues just kind of not doing much because of the tumors affecting my life. And I really wanted to go into the military when I was young, and that prevented me from going to the military. So I tried a career in law enforcement, but it prevented me from furthering my career in law enforcement because it just became too debilitating. Now I'm doing a lot better. I found the clinical trial to be on that helped my tumor. It shrank at 57%, which is a very significant amount. It ended up giving me a whole new outlook on life and able to do a lot more thanks to being in less pain and being able to do a lot more outdoor activities, which I love to do since I'm an Eagle Scout, and go out hiking, camping, kayaking, and all that.
First of all, it's important to talk to your physician, right, whenever you're going to be thinking about treatment options. I think historically, we were really limited to surgery in order to try to treat plexiform neurofibromas. And like Austin's story kind of tells, most of the time with surgeries, we can't get the entire tumor out. And over half of the time, it grows back. In 2020, there was one medication that was approved for children with NF1 plexiform neurofibromas. And then excitingly, in February of this year, we finally have the first FDA-approved medication for both adults and children with NF1 plexiform neurofibromas. So it's a medication called Gomekli, or mirdametinib. And the medication has been shown to shrink these tumors significantly and also decrease the pain that patients are having. Every medication comes with side effects. The most common side effects for this medication being gastrointestinal issues, so things like nausea, sometimes vomiting, more often diarrhea, and then rashes, like an acne-like rash is really the most common side effect. You can check out more information at gomekli.com. That's GOMEKLI.com. And I think another great resource for patients is the Children's Tumor Foundation website. There's a lot of information for patients on treatments and also just resources for support for patients.